Hello, my name is John Nye, and I'm the product manager for IoT Secure's IoT Security Appliances. And today I'm here to tell you a success story, how IoT Secure helped one of the United States' top 10 hospitals. In this video, I will expand on the details from this use case, wherein a large healthcare network with over 2,000 beds and over 150 locations was able to use IoT Secure's solution to help them deal with some key challenges that they were facing. Firstly, with over 10,000 connected medical devices in operation, they needed a way to identify connected medical devices. But we needed to go further than simply identifying these devices, beyond simply reporting the make, model, and version of these devices. They also needed continuous threat protection to safeguard these critical and sensitive networked medical devices. Additionally, they needed a single source of absolute truth for their biomedical computerized maintenance management system, or CMMS, as well as seamless integration into their already existing ITSM workflow. The remainder of this video will be divided into 4 parts. First, we'll look at this healthcare customer's profile. Then, we'll discuss the specific challenges that they faced. We'll talk about why IoT Secure was the right choice for them. And finally, we will look at the specific results and outcomes as they pertain to this customer in their experience. The customer we're profiling today is one of the United States' most prestigious medical centers, employing over 40,000 people. This healthcare network uses a curated population health perspective to let them focus on the specific needs of the communities that they serve. With nationally recognized clinical excellence, they are committed to deliver coordinated, compassionate, science-driven care wherever and whenever their patients need it. This top-notch care is improved greatly by utilizing the latest in medical IoT and other connected technologies. This healthcare network consists of hospitals and long-term care facilities that together have more than 2,000 beds. In addition, they have state-of-the-art primary and specialty care that is provided through their network of more than 150 locations around their region, leaving them with a little more than 500,000 endpoints connected at any given time. Key challenges. This healthcare network faces challenges similar to what most healthcare organizations are facing today. Their legacy tools, for example, their existing firewall, intrusion detection system, and endpoint protection solutions, couldn't do more than show the total number of IP and MAC addresses in use. These legacy tools could not identify the specific device type or evaluate the risk posed by these connected devices. Furthermore, the current toolset they had was unable to detect unusual or suspect behavior, let alone determine if or when an IoT device was actually compromised. As is common with the majority of our customers, their compliance and networking teams did not want to utilize a solution that required access to full packet capture or tap span ports. Packet capturing is particularly risky for healthcare since they deal with so much electronic protected health information, or EPHI. This meant that before IoT Secure was brought in, the vast majority of their connected medical and infrastructure devices were unmanageable and unidentified. In fact, the CISO specifically asked us, how can I get immediate visibility today into my connected medical IoT devices on our network without having to collect network tap data that includes PHI and sensitive data? As with all connected devices in IoT, they did not support running software agents, nor could they produce useful logs, making them excessively difficult to identify or monitor for security purposes. Following industry trends, manufacturers did not build security into devices themselves. In addition, the connected medical devices could not be configured and frequently had default passwords that were easily obtained on the internet. Whenever manufacturers or their partners assessed the security of their devices, such as IP cameras or surgical robots, the security team had no method of validating their assessment. They weren't even able to research a device's behaviors and mode of operation, leaving them virtually blind. They needed to know what devices were sharing the network with connected medical devices, because in their environment, connected medical is considered critical to operations, making it very important for them to know exactly what IoT was on the network, as well as where they were located within the network. They needed to know so that they could exclude these devices from regular vulnerability scanning and NAC operations. While they did have a NAC solution in place, the vendor was only able to identify IoT based solely on the MAC address obtained from the device's NIC. Since many IoT manufacturers use third-party network cards, this information was inaccurate and essentially useless. The connected devices on their network's issues didn't stop there. Devices also exhibited risky behavior by default. They were known to be connecting to other devices and transmitting data, known to be using hard-coded credentials that could not be changed, and automatically opening insecure ports and protocols like Telnet, FTP, and HTTP. Finally, for this customer, integration with their ITSM provider, ServiceNow, was a high priority. By integrating with the ITSM, they could operationalize the data and implement IoT incident detection into their workflow, as well as alert help desk or other operators to new and dynamic threats. Why IoT Secure? The medical center's security team was told directly by GE, Siemens, and Philips that under no circumstances should the devices be controlled by their Network Access Control, or NAC. The representatives from these major connected device manufacturers went a step further and said that they should not run any kind of vulnerability scanners against their devices, as the legacy scanners are intrusive and could cause catastrophic issues. The security team, concerned that these critical devices had no inventory or security tools, reached out to IoT Secure because our solution deploys in minutes and does so without tap, span, or software agents. Additionally, IoT Secure was their choice because our solutions do not, under any circumstances, collect any PHI, PCI, or any other sensitive information, allowing them to stay comfortably within the framework of HIPAA compliance requirements. The implementation of the IoT security appliance was 100% automated once the IoTSA was plugged in. Unlike NACs or vulnerability scanners, IoT Secure runs non-intrusively using our unique port-safe inspection technology, which is safe for all connected devices. Our automated discovery of every single device connected to the network accurately identifies devices by make, model, and version. We accomplish this through a proprietary method that does not rely solely on MAC address lookup. Our solution will also categorize devices by type, including restricted devices, and identify what network or VLAN the device is on, as well as reporting all ports that are in use by each device. Utilizing continuous threat detection, we determined which devices could be hijacked or may have vulnerabilities. When any device connects to the network, the IoTSA tracks it and all at-risk devices across your networks, all from a central deployment. Optionally, we can also check for default passwords, exploitable ports, and ransomware. Alerts are generated when devices are on the network that come under CVE, ICS Cert, or other advisories. This automated, continuous, and device-specific security monitoring profiles each device's behavior and communicates comparing it to the profile of the device's default behavior in the IoT Secure device library. Results are then operationalized by integrating with existing ITSM or SIM systems, as well as the option to generate alerts via SMS or email. The customer's impact, results, and outcomes. Within 24 hours of passively plugging in the IoT Secure application, this customer had an eye-opening experience when reviewing the results on the initial report. They were shown over 500,000 devices connected to their network. Like most organizations, they were only aware of about 20% of those devices in their inventories. They also saw numerous connected medical devices that were on the wrong network segment, and thousands of devices that were at risk. Many of the vulnerable devices were subject to known exploits and device takeover methods. Unmanageable devices accounted for 35% of their total devices on the network, but accounted for 70% of the at-risk devices on their network. All of this information was categorized and operationalized by integrating the data into their ServiceNow ITSM and populating their support tickets with enough detailed information that the operators could easily troubleshoot and remediate discovered issues. To recap, this large healthcare network deployed without network tap or span in less than 30 minutes. They profiled over 500,000 devices, finding over 10,000 previously unknown medical IoT devices. They gained visibility into thousands of at-risk medical and other IoT devices. They achieved integration with ServiceNow for help desk and support automation, and they streamlined and confirmed asset inventories. If you would like to see the IoT security appliance in action yourself, we'll let you do so for free. Go to iotmini.io to request your free IoT Mini and start your IoT security journey today.